These are some of the patients that we have, so you don't think I'm just making this up. This patient here fell 500 feet out the sky, parachute tangled at 500 feet, hit the ground about 80 miles an hour, went in immediate cardiac arrest. Luckily, there was a paramedic there, started CPR on him immediately. He was airlifted to Grady Hospital. So basically, he was like Humpty Dumpty, broke almost everything in his body. So he had over 18 life-threatening injuries, and most people thought he wasn't going to survive. They tried to encourage me to get a DNR, told him he was going to walk out of the hospital. They thought I was crazy. So we calculated his mortality rate to be over 300%. Technically, you can't get over 100%, so we just kept going after we calculated. So 3 months later, this gentleman made a full recovery. He's actually now married. He's walking, talking, driving cars. He does not have post-traumatic stress disorders, not taking a lot of pain meds. His wife is actually from England, so she wrote me a lovely letter and sent me this picture. She was saying, I didn't know my husband when he was injured. They weren't married, but she said, had you not saved him, I never would have moved to the United States, never would have gotten married. And she said she'd basically given up and she was kind of chronically depressed. So basically, it's nice to see the end results of some of your work. So she's a happy lady. They live in Savannah, Georgia, so they're a happily married couple.
I was less than 5 minutes away from my job when a pine tree fell on my car. One of the branches went through my windshield and it impaled my abdomen and it exited through my back. And I woke up to all the wonderful, wonderful Grady doctors. I am the first known survivor of this type of injury. And I mean, praise God for Grady that I'm here.
Here, this young lady was driving to work and during a thunderstorm, a 110-foot tree fell and a 50-foot limb came through a windshield and impaled her. So when the paramedics arrived at the scene, she was totally impaled by a 50-foot limb. So they basically cut the limb out at about 5 feet and brought her to the emergency room. So it went all the way through her, and that's from the backside. You can see the limb sticking out the backside. So this lady actually had glass, dirt, grass, pine cones, and everything else inside her abdomen, multiple bowel injuries, bladder injury, basically damaged most of the internal organs. So you would not expect this lady to survive from the sepsis that she would have after that. She had 18 operations. This is her. She's actually walking. She's independent. So the thing is, with our high-dose vitamin D, most of these patients are able to survive. Most of them are able to return to some function where they're not costing the government a lot of money. They're not laid up in nursing homes or long-term care facilities. They're not. Some of them even going back to work. This is a patient. I love this patient here because he's a rock star now. This gentleman was actually injured on Super Bowl day 3 years ago, riding his bicycle. He was hit, knocked 40 yards off his bike, had a severe traumatic brain injury, and broke about 46 bones or organs, and he was bleeding from all his internal organs. His survivability was 0 or less, and he was told by the neurosurgeons he would never wake up or never think or do anything again. This gentleman actually got a promotional raise. He's a stockbroker with one of the largest companies in the world, and he actually got a promotion after he returned to work. He actually rides his bike 20 miles every other day now. And so he's actually all over Grady. He's on billboards. He's on the side of buses. He's on videos.
Last year at Super Bowl, I decided to take a bike ride with my buddy, but I didn't make it to the party. I was hit by a car. Obviously, I needed emergency care to survive. Fortunately, I was taken to Grady Hospital.
I was really scared. And I remember Keisha, the nurse, just came over to me and she held my hand. She said, it's going to be okay. If it wasn't for Grady, Richard wouldn't be alive. When you saved Richard's life, you also saved mine.
So this gentleman here was on the left here was shot 15 times by this guy and other gang members. He tried to get out of the gang and wanted to change his life, and they told him all the way out was to die out. So he actually set a record at Grady. Grady had never had a patient be shot 15 times and survive. So you get shot 15 times and all 4 extremities break, all the major bones in your body, get shot in your torso and your abdomen, and bowel injury and basically every major organ injury, you're going to die from sepsis. So what vitamin D does is get these guys' T cells up higher enough and help them survive that septic count. So he's not on any chronic medications, and He's not taking a lot of pain medications. We saw him back in clinic. He's doing well, got out of the gang, and get a second chance at life. So vitamin D makes a big difference in terms of infection and for a surgeon's standpoint, because that's the thing that hurts surgeons is infection. This lady and gentleman was assassinated point blank range in the top of the head and left on the side of the road for a couple hours. So the boyfriend, husband was dead on arrival. They didn't even bring him in, brought her in. She had a pulse about 60, weak blood pressure. So we were able to keep her alive and found out she was pregnant during our exam, so we were able to deliver the baby. Who basically was survived, and that was a successful story. The mom later died several days later, but we were able to keep her alive on the vitamin D, but she had been out too long and had too much brain swelling and had started herniating. A young lady on the left there, we call her the model. She's actually was in a coma for 4 weeks, had a severe, devastating brain injury. Nobody thought she'd survive. She's actually went back to college, and she was a AB student, after having a severe traumatic brain injury, being in a coma for 4 weeks. This gentleman here basically severed his neck on the right side with a chainsaw, hit a log, and just totally severed all the vessels in his neck on the right side all the way down to the vertebrae. Came in and cardiac arrest. He had lost his whole blood volume on the stretcher, and so when they got him in the operating room, they pronounced him dead, had pulled the sheets over him 8 minutes and pronounced him and disconnected him from the ventilator. Everybody else had left. So for some reason, I was kind of lingering around. Usually when somebody's pronounced dead, I have to move because we have to have 4 or 5 more patients I have to attend to. And so I kind of lingered around. Nurse said she saw his finger flicker. I said, it's just probably a reflex. But I went in, transfused him a unit of blood, heart started beating. So I got my team back in there. We sewed up all the vessels in his neck. He made a full recovery. And actually, People magazine was going to do a story on him, but he got himself arrested. And so basically I called to the jail. And so imagine trying to tell a judge that this guy was dead, but he's like, he's alive. How can he be dead if he was alive? So the judge was like, he was playing on words. I said, well, he has a hypoxic brain injury. Shouldn't be held accountable for what he did. I said, this guy actually was brain dead for 8 minutes. And he said, well, he doesn't look dead to me. He looks fine. And so he had recovered most of his function in that short period of time. So usually without traumatic brain injury, usually take them about a full year to recover most of their memory back. And so that's the thing. And some of them have like headaches for a few weeks, few months. And so I asked the judge if he can put him in special areas so nobody would take advantage of him due to hypoxic brain injury. He elected to stay in the general population, so he's quite a character. He actually called to collect phone call from the hospital. He couldn't reach me, so he thought I had left. So he's pretty funny. This gentleman here was stabbed in the heart, and so he went into cardiac arrest in the emergency room. No oxygen to his brain for 5 minutes, so I had to do open cardiac massage, ER thoracotomy on him. Had a big laceration in the right ventricle. Got him upstairs, went into cardiac arrest a second time for 5 minutes, so he's in cardiac arrest for a total of 10 minutes. So he had a hypoxic brain injury for 10 minutes, so he made a full recovery and doing fine. This here is a 17-year-old young lady. She had just made head cheerleader. SUV rolled over 5 times, and she got ejected, and she was seizing on the scene, and she ended up having a diffuse axonal injury. Anybody in medicine know diffuse axonal means your electrons or your neurons, you just shear them, you just rip them. So it's kind of like somebody just cut a hedge and just ripped them. So it's kind of such a violent act. Very few people recover from this. You have a 50% mortality rate with these diffuse axonal injuries. 47% of people were in permanent comas, and then the 3% that do return some function, they return to kind of like cerebral palsy people. They very seldom, if ever, return to normal. Her mother happened to be a ER pediatric nurse at Egleston Hospital, so when we told her how devastating the injury was, she was a special young lady. Mom and dad had to go through artificial insemination to have her. They had to go through multiple attempts, and so having to tell them they're about to lose their 17-year-old daughter that they worked so hard to conceive. And a neurosurgeon originally refused to put a bolt in her head because of the severity of the injury. He said there was no way she would survive. This young lady also had a clavicle fracture, sternal fracture, cardiac contusion, pulmonary contusion, a right ACL, complete tear. And she made a full recovery, returned to school in 3 months. This is her now. This is Lacey. Lacey is a junior getting ready to transfer to the University of Georgia. She's a straight A student. It was about a year or 2 later. So the only thing, she just had a little blurred vision at night. So I told them to get some night glasses. but she's doing exceptionally well. She's totally recovered from all her injuries. She's independent. She's not in a nursing home. She's not on a ventilator. She doesn't have a trach. So she's actually, most of our patients basically return to some function, so she's going to be a tax-paying citizen. So Lacey actually wants to work with little kids with traumatic brain injuries, so that's her life, and she's going to be very great at it because of what she went through herself. She's very graceful, never complained, and so most of our traumatic brain injury patients with the vitamin D, we keep them on it even after they get out of the hospital. This gentleman here basically had a brain injury, diffuse axonal injury, just like Lacey, the previous little girl. So that's him. All the nurses in the hospital were crazy about him. He's a comedian. His personality came right back after he actually woke up. This gentleman here is probably the most remarkable. This is a 31-year-old gentleman. He ended up having a subdural and a subarachnoid hemorrhage after being assaulted. Okay, this gentleman, for the medical people, he was HIV positive, hepatitis A, syphilis, shingles, alcohol abuse, had a CD4 count of 46. ARDS, ventilator-associated pneumonia. So would you expect that person to survive? The mortality rate just for his head injury alone with a subarachnoid subdural is 40%. Then you add in HIV and a CD4 count of 46. That means he has no immune response. So 46, I mean, he has 2 T cells in his whole body. They're trying to fight off all those different diseases. So after we started him on vitamin D, his T cell count went up over 500 and stuff. I mean, just so you can actually see for yourself, I'd advise you guys, get a CD4 count on your patients, then give them some vitamin D, then see a few days later if your CD4 count go up. This young lady here was stabbed in the head by her boyfriend. You see, he broke the knife off in her head, and so it's all the way down in her brain. And he also stabbed her in the abdomen, so there's blood around her liver and spleen. So she had to have 2 procedures simultaneously. We were the trauma surgeons, so we had to operate on the abdomen, stop the bleeding internally from the liver, while the neurosurgeons were doing in-block resection, cutting little brain tissue and removing the knife out of her head. She initially had a right hemiparesis in her right arm, but 6 weeks later she made a full recovery from her right arm, got all her motor strength back, so we returned to normal function. This young lady, her boyfriend tried to do a suicide homicide. He shot her in the right mandible, and as you see that black area, he blew out some brain tissue there. So the neurosurgeons told the parents this lady would not survive. Actually, she's been at Grady now. Mom emailed me the other day and saying they're putting her skull, they had to take half her skull off and put another part of her skull back. She's regained a lot of her function. She was totally paralyzed on the left side. She's regained about 60% of her function back, so I told the mom it'd take her up to a year or 2 to get all her function back. So that's another part. This white stuff you see inside is blood, and then plus her brain tissue just totally devitalized. So this gentleman here, 57-year-old male, he was depressed because his wife had divorced him, his brother had just died, so he shot himself in front of 2 policemen, Atlanta policemen, after he pulled him over, in the chest, barely missed his heart by a centimeter or 2. So when he came to the hospital, he had a stroke in the hospital and a heart attack, and he's 57 years old with a bullet wound in his chest also. So after he had the heart attack, his ejection fraction went down to 25%. He went into congestive heart failure, he got pneumonia, he had alcohol abuse, he was depressed. This gentleman made a full recovery. The reason you see him bending down, because stroke patients, you ask them to close their eyes, they can't hold still, they can't stagger like that. You ask them to bend down, touch their toes, they fall over. So afterwards, he was treated with high-dose vitamin D. He got most of his function back. He's actually now, last time I saw him in clinic, able to walk up 5 flights of stairs. And the biggest problem I'm having at Grady now is we can't get psychiatry admitted into our patients that have tried to commit suicide, because when they see them, they're off the ventilators. They tell them they're fine, they're doing well. I'm like, this guy shot himself in front of 2 policemen. So I said, well, I don't understand why he didn't get admitted. So I can probably count the number on one hand, the number of patients last year that psychiatrists actually inpatient admitted, because by the time they see them, they can't talk to them on the ventilator. So by the time they see them, their vitamin D levels up, they're happy, they're well adjusted. But I'm still kind of cautious about sending patients home, but they're the experts. So we put all our patients on high-dose vitamin D. Our readmission rate for all these bad trauma patients you see, you would probably think is high. Our readmission rate is less than 1%, so we'll get readmitted. And our mortality rate is about 4.8%. And so we've lowered our mortality rate, lowered hospital cost, and lowered our infection rate, and patients do well and go home. This is a young lady, a nurse practitioner now, so I've always had to be creative in my career. So it was in Mississippi. I was working ER once again when I should have been resting while I was on vacation. And so I used to work all my vacations when I went home. And so Marcy had SVT, supraventricular tachycardia, heart rate went up to about 225. So it was on a morning of her wedding. She spent over $20,000 on a wedding. And so to tell a young bride she can't go to a wedding is devastating. She started crying. So as physicians, we have to treat the person and not just the disease process. So I said, well, Marcy, we can have a wedding here in the ER. She's like, are you kidding? I said, no, sure. I said, you have a nice story you can tell your daughter, your kids. And so we called the priest. The priest got permission from the diocese in Jackson. So we brought all the bridesmaids and their dresses to the emergency room. And so she has on a hospital gown. We fixed it up, made it look like a wedding gown. And that black thing you see running is a cable monitor on her. I'm standing behind her with jumper cables. So while she's getting married, her heart rate goes up to 230. So I'm telling her she needs to calm down before I have to shock her.
I ended up falling 22 feet to the ground, shattering my pelvis.
I couldn't really move a lot because I was really injured. My leg was really fractured. I'm blessed that I went to Grady.
They realized that this was a level 1 trauma and the hospital really couldn't handle this. So they were like, oh, he needs to go to Grady.
And Dr. Danner came in and he looked down at me and he says, I can fix all that.
Grady put me back together and gave me a second chance. As my son would say, they put Humpty Dumpty back together again.
And my tractor caught my foot and knocked me down and run over me and put me on the stretcher and put me in a helicopter, and I didn't believe I'd ever walk again. He said, I'll have you back on your tractor in a year's time. Can't say enough for the hospital. He was great to me. Oh, I love Grady.